Welcome to Psychology Matters. It's good to have you here today, and I'm so happy to have a guest with us, and it's someone that I know rather well, Robbie Hutchens.
Yes.
Welcome, Robbie.
Thank you so much.
It's great to have you here because you do so much work in an area that I think that there's a lot of misunderstanding, confusion, lack of information in, and I think we could all benefit from getting a better understanding of what we mean when we say on the spectrum, and in particular, children on the spectrum. And you work with children on the spectrum, and you're a licensed marriage and family therapist,
That's right.
Okay. So, can we just talk first about definition?
Sure.
About what we mean by on the spectrum.
Autism spectrum disorders have the name spectrum because it has a variety of presentations. It is a group of developmental disorders, and developmental really means that the condition, in this case autism, the onset was in early childhood, between ages 1 and 5. And typically autism is symptoms are seen between the ages of 1 and 2. But a developmental group of disorders where you have very high functioning individuals, and then you have moderately functioning and then more lower functioning individuals. So the spectrum term is there to remind us that there's a wide range of abilities and deficits.
Okay, so it's not like you have this or you don't have that. This is kind of like where you are on this range, this spectrum.
Exactly.
Okay, and so a specific population that you work with are children who have been diagnosed with autism, or maybe even pre-diagnosed.
Correct. Yes.
Yeah, I was wondering about that. So can you speak to autism a little bit, and what that is, what that looks like?
So in terms of the behavioral presentation of autism, there's really a couple of categories that are used to diagnose, several symptoms in each category. One would be repetitive or repeated behaviors in an individual, in addition to restricted interests. That's one category. And the other category is deficits in social situations, and they're chronic and ongoing. So it could be problems with interaction, problems with communication, but under those two categories is where you find most of the symptoms. However, for someone to receive a diagnosis, there has to be, some symptoms present before the age of 2. The symptoms have to be present across multiple contexts. So in other words, if someone has some restricted behaviors, let's say only at school in the morning, a diagnosis would not be made.
Right.
It would be that we see these in multiple venues.
Home, school,
That's right.
shopping with mom.
Formal and informal, right? In relaxed situations or in more structured situations.
And so you said repeated behaviors. Do you see that in a need to have pattern, like overly organized pattern?
Some of the thought leaders in this area talk about the child's and the individual's need for predictability.
Right.
And part of the thinking is that, let's take motor activity. When you see stimming, where you see a child perhaps shaking, you see rocking, or those kinds of behaviors, it's a way to create some predictability. And so you could see it in that. You could see it in echolalia, which has to do with repeating phrases, repeating words, singing the same song over and over again. It can also just be being hyper-fixated in one routine, in one ritual that they want repeated in the exact same order. So it can have several different presentations in terms of repeat.
Yeah. And so like you said, it's on a spectrum. So one child's need for that predictability may not be as fierce as maybe another child who can't function at all without that. Does that make sense?
Correct, and that's part of the designation of a low-functioning individual versus a higher-functioning individual. And so that's one of the ways that you approach an individual as looking how much impairment is there,
Yeah.
how much impairment is there during the daily routine.
Yeah.
And someone who has significant impairment, cannot get through basic tasks, would be a lower functioning individual. And someone who is able to do most tasks, but there's certain areas where they really have hiccups, and they continue to over time. So that would be a higher functioning individual on the autism spectrum.
So I would imagine this sort of thing, you're talking about identifying it at possibly 2 years old, that's got to be heartbreaking for parents.
Yes.
And I would imagine, this has happened in my family, I would imagine that many go through denial in the beginning. Is that what you see?
And I would say that is the common way people perceive what's happening. I like to think of it as a systems person, like to look at someone's relationship with a label or a diagnosis. And I prefer the term lens in the beginning when we begin looking at an individual, because in some cases diagnosis is very concrete, black and white, straightforward, a team of people with good assessments. In other cases, it's very ambiguous. It's really confusing.
Right.
So sometimes the grief is because there isn't a clear answer.
Yeah.
And it doesn't point in a particular direction.
So you don't know how to help the child.
That's exactly right.
Yeah.
So there's grief not only with imagining the child's future and your relationship with the child, but also, I don't know what to do tomorrow, because I'm not sure where my child lands and if they're even possibly on the spectrum.
One of the things that I've noticed is that gifted children, the true category, of gifted children, I don't know about you, but I think my child was gifted. We all think our children are gifted. But in the sense of gifted, the way that we look at it in science, clinically, is that a similar situation as to those that are on the other end of maybe the spectrum? Are there some similarities in that?
The similarities that others who are experts have shared with me are that both have uneven development in the brain. This very uneven pattern creating excesses and deficits. And it's more extreme in an individual with autism,
Right.
where you have almost these super abilities. We've seen in movies someone able to memorize an entire phone book, but unable to tie their shoes or brush their teeth. In intellectually gifted individuals, there is also uneven development in the brain. However, it's not as extreme. You may see the memory particularly strong, or you may see the logic particularly strong, or you may see the visual spatial ability particularly strong. But it's not to the extreme of someone on the autism spectrum. However, you can be diagnosed, on the autism spectrum and also be intellectually gifted.
That's really amazing.
Yes.
And I would imagine most folks don't realize that or know that. So what is the prognosis for children that are diagnosed as autistic, somewhere on the spectrum, according to the kind of work that you do and the people that you collaborate with and work with? What's the prognosis? How can we help these children? Is there help?
That is highly variable given when an individual is diagnosed.
Yeah.
The earlier the diagnosis comes, the more realistic the expectations can be, and the more interventions can begin. So that's one predictor. It's not the only predictor.
So that's a critical factor. If
It
you
is.
suspect that, get a diagnosis, get in and have your child assessed.
Right.
Okay.
And the sooner that interventions can come,
Right.
the sooner that an accurate understanding of what an individual's strengths are and what their deficits are brings so much anxiety down so quickly. So that's something you'll probably hear repeated often is early diagnosis, early intervention, and that is why. However, I often see kids in my practice in junior high where that is suspected that a diagnosis has never been made. So there isn't time necessarily for early intervention, but that doesn't mean there aren't so many important conversations and assessments that can happen at that point, and begin some skills training, and begin some perhaps occupational therapy,
Oh, yeah.
or other interventions. So I take a strengths-based approach, and we're going to start wherever folks are, and work as hard as we can for as long as we can.
See, and that's one of the things that I really admire about the work that you do, because you do have that approach. And the other thing is how collaborative you are in pulling together a team around that child and that parent, and working, and you even work with the school systems for these children, right?
Yes.
Can you kind of give us an idea of what that looks like? You know, what does it mean to collaborate and pull a team together?
I just noticed in working with the children early on, as I was learning how to be a good therapist, that there was not a united front, and there was not agreement about what the child could or could not do.
Right.
And so I realized also that there was an enormous amount of pressure on the caretaker, and that information was not getting passed from professional to professional, or to school system, or to family members. So one of my priorities became very quickly to create a united front among everyone in the child's life, the entire system around the child, not just the nuclear family.
Right.
So, and in doing so, I could get everyone on the same page, and I can also understand how the child's functioning might be a little bit different in a different context. So it was really best for treatment, but it also, it creates a collaborative community for the child. And this is a high needs child typically. And in this case, I think it's very easily seen that it takes a village, you know, to raise a child. And when you have a caregiver who is burdened or isolated or exhausted, may have illness of their own, they desperately need others to support them, to give them relief, to challenge them across all different fronts. So that's one of my priorities, is getting schools, doctors, therapists, like occupational or physical therapists, family members, extended family members, in session and involved in understanding who this child is.
So amazing that you do that. I was just thinking about those, what do they call them, SROs in the schools, and how easy it is to misunderstand a child who is on the spectrum when things go awry or something is unpredictable and there's a reaction to it.
Yes.
What can happen is, if someone doesn't understand, is not on this team that you're talking about, then their reaction can actually amplify the problem for the child, right?
Yes, that is often typical.
Right.
And almost every individual I meet in a school system is well-meaning, well-intentioned, and they are just needing more information and different skill set, for example, for de-escalation. And so part of what I do is try to find who are the individuals who have been left out, right? And it is common for an SRO to interpret a child's behavior as being defiant.
And we should say SRO is the school resource officer, right?
Yes.
This is the person that shows up when there's a problem,
Yes.
a behavior issue in the classroom, whatever, that person is called
If the
in.
behaviors are extreme or aggressive, or a teacher just asks, or a staff
And sometimes
asks.
that's a armed officer.
Correct.
Right. Okay.
Yes.
Well, so this is really important that they understand.
Yes.
And that's a different kind of training than what they've been through.
Yes.
Right?
And part of that is to establish a positive,
Yeah.
relaxed relationship with the officer before an event like that would happen, so that the child could trust, and there'd be some more predictability, right, in that relationship, and so that the child would not feel anxious around the officer, and the officer would have more power of influence over the child if the child became dysregulated or aggressive.
So this seems like there's a whole lot of areas. There's lots of areas in all of our lives. And when you look at a child that is on the spectrum, has been diagnosed with autism, you can't just treat one thing in a counselor office and expect that that child's going to thrive like he or she may if you collaborate and you look at all aspects of that child's life. School, home, social, what am I forgetting?
The
Occupational.
Yeah, the medical and the biological part. And so there are, the more eyes,
Right.
you know, the more accurate the assessment can be, the more effective the intervention can be. And it's just, I love to see people get excited about their work. And that's the joy of this, is inviting others to partner with you, to collaborate for the best interest of that kid. And it brings them joy to help them understand the child's needs better and to help you problem solve. And many times others in different contexts have much better ideas than I have. They have expertise, they have creative problem solving. And it brings people joy and relaxation to be able to bring relief to this child and help the child grow.
You know, I think one of the most beautiful moments that I can remember is first connecting with my nephew who's been diagnosed with autism. And the way I did that was being around you and hearing a lot of your conversations, because frankly, it's the first time I've ever been around someone like that. And the way we connected was me doing repeated phrases, patterns, lining up colors, lining up toys, and he looked at me and he smiled. Like, you get it.
Yes.
You get it. That's amazing. So there's so much parent education in this, right?
Yes, absolutely. And you had a realistic expectation of what bonding was like for that child in that moment.
Yeah, it's huge, isn't it? Because they are often misunderstood, right? Wow. So, wow, so much. And then we see so many cases now of autistic children, don't we?
It is, that's part of, you know, in reflecting back, are there more children diagnosed, you know, with autism, or are more people aware and are able to get assessments, you know, done more quickly, earlier? And so the latter may be more true, as opposed to the numbers are growing. I can't say for sure, but that's one of the discussions going on.
Yeah. So I would imagine that you're sought out with the knowledge that you know and the resources that you've built, that there are parents that look for that.
Yes.
So are there special places in Tennessee or even in Nashville that people can go to get help, resources, more information about autism?
The Kennedy Center at Vanderbilt is an extraordinary resource here in Tennessee. And there are clinical trials there, research going on that families can participate in. There are excellent diagnostic facilities, speech and language pathologists with specialties there. And so Vanderbilt is a wonderful starting place for individuals on looking for more information and support. There's even a helpline parents can call at the Kennedy Center at Vanderbilt.
So do you think it's important, well, let's say, is it necessary for a parent to find a therapist that understands autism, that they have some sort of specific training in that area in order to be successful in working with that child?
I think that if a therapist is open to learning and is willing to start the collaborative process, that can be just as beautiful and helpful as someone who knows, who already has a running start. But it's certainly true if parents are in a particularly stressful place, finding someone who already has knowledge may be the best place to start. But that's how I started. You know, is a parent asked me, would you be willing to learn more about this? And I said, you know what, I think I would like to do that.
Wow. So now, can we go to the other side of this, the gifted? I don't know about you, but I've had my challenges in working with those that have been diagnosed as gifted, because it seems that when you get that diagnosis of gifted, it's easy for us to treat them as if they're the age or emotionally that they're up there where they're operating intellectually. And it seems like that's a problem because often emotionally they're not where they are intellectually. Is that accurate in what you find?
Yes, yes. And the thought leaders there talk about, again, the uneven development, where parts of the brain are more adult-like and other parts of the brain are lagging behind. You know, organizational skills, emotional regulation, you know, places where you might see more emotionality, I guess, emotional explosiveness, or where it's more obvious, I guess. And so it appears that someone would be less mature when in fact it's just lagging skills. It's just the way the brain is developing. And the thought leaders and experts say that usually by age 27, a gifted individual's brain finishes developing. And it all comes together in a wonderful, even package. But before that point, you know, you have a lot of excesses and deficits in the brain that you've got to learn to moderate. It's very stressful.
Oh, I would imagine so, especially when they're in their teen years.
Yes, absolutely.
Working with adolescents.
Yes.
So have you found some modalities that work really well in helping these children be able to get better with social skills and relational skills? Have you found some things that seem to work better?
One thing it is typically true about kids who are gifted and adults who are gifted is they want to see that something is very practical and useful. And so I try to marry what their passion is, their area of interest, with very practical, useful interventions for them. What can I use tomorrow? So if they have ownership over that, and we help them create and connect the skills that we're building to building a positive future in their passion area, I find that they are more motivated, as opposed to a therapist just choosing some helpful techniques.
It's almost like you're allowing them to be a scientist in their own life to help decide what works for them.
It's a more egalitarian approach.
Yeah,
And I will tell you that taking a one-up stance with a gifted individual usually isn't helpful. Having an egalitarian stance is a lot more rewarding and effective.
So is that the same case with the children that we would say autistic and lower functioning?
Yes, I have the same value set about that, that I am strengths-based and I'm egalitarian, and even though I may slow down my communication and my goals, I still want to involve the child as much as possible in what I do.
I gotcha. So, okay. I was wondering about equine therapy. I know that there's been some of that done. What does that offer for some of the children that you work with?
There are two different ways to really go with that I've seen with children on the spectrum. And one is the more occupational functioning avenue, the physical avenue of learning to sit in position, gaining strength, balance, the physicality, dealing with the sensory issues and learning assertiveness is one piece. But also the other piece is the relational piece, and learning how to take leadership and take initiative in a relationship. Learning how to read nonverbal behaviors in an animal and then transferring that to a person. And typically horses, and I'm not an expert in equine therapy, but people who work with children say that the most sensitive horses are the most helpful, because if a child is dysregulated, if a child's upset, the horse will show that and demonstrate that, and they can help the child connect in more obvious ways, that the horse is trying to communicate with them.
So there's creative ways that you can use and suggest in working with children on the spectrum.
Yes, the more visual and experiential, that's typically the child's strength.
Yeah.
And so if you lead with that, that is usually the most effective.
That's got to be something that offers a lot of hope for the parents.
Absolutely.
When they see that.
And if they can see progress, even if it's in short doses, that gives them lots of hope and lots of motivation to keep going.
So if you were going to advise, just something very simple, a parent who may be out there thinking, oh, that might be the case with my child, what would you offer them? What would you say?
That autism is not an identity. It's a lens, it's a description of part of you, and that you have the ability to have power over what that means and what that doesn't mean.
Right.
You know,
Right.
so I would first say that it doesn't have to be oppressive and intimidating, is the first thing I would say. And then to go explore all that they possibly can, to learn about how this lens could possibly be useful to apply to their child or themselves.
That in itself is encouraging and hopeful. You know, I haven't worked with very many that have been diagnosed with autism. I've worked with a couple that were diagnosed as gifted. And I think it's challenging work that you do. It requires a deeper understanding. It requires patience.
It does.
And a way to connect with that parent in a way that the parent is heard and felt as well. Right.
It is a high stress situation for parents who are caregivers, and so it does require a slowing down, a more thoughtful, complex approach.
So do you find this work rewarding? I can see your passion.
I do. I really enjoy it when we've been working a really, really long time for some gains, and a child is able to do things that others didn't expect them to do. That's incredibly rewarding.
That's such a good way to end. It's so wonderful that you've been here to share and help educate us about working with children on the spectrum, about what that means, being on the spectrum, the differences between autism, low functioning, all the way to gifted. I think it's really great to have this information. So for any of you out there that do have questions about working with children on the spectrum, you've heard some resources. I think maybe reaching out. We have great resources in just the internet, autism and Nashville. We've had walks in Nashville, I think, just recently. So there's a lot of parents that are coming together, parent groups. I would imagine that some support in that area is a good thing as well. So we'd like to say thank you for joining us, and our heart is with you for those parents that are coming to know or maybe about to know that this could be a situation that they're working with. There's great promise, apparently, and great hope in working with your children. So thank you for joining us. Psychology Matters.